Right after Botox, most people do at least one thing that quietly destroys their results. They massage their face, hit the gym, sleep face down, pour themselves a drink to celebrate. None of it feels like a big deal in the moment. But each of those choices, made in the wrong window, can compromise your outcome in ways that won't be obvious until days later. In this video, I'll walk you through exactly what's happening inside your skin in those first 48 hours and why every single restriction has a real clinical reason behind it. This isn't just protocol, this is physiology. Botulinum toxin needs a stabilization window after injection. Once it's placed into the target muscle, it begins binding progressively to the receptors at the neuromuscular junction, specifically the snare complex, which is the mechanism it blocks to stop muscle contraction. That binding process takes between 24 and 72 hours to complete. For the first 48 hours, the toxin is still anchoring itself. And in that window, external factors can interfere, either causing the toxin to migrate away from the target area or accelerating its breakdown. That's why what you do in the next 48 hours matters more than most people realize. Touch and pressure. The first and probably most important rule: don't touch, rub, or massage the treated area. Sounds obvious, but most people violate this without even noticing. They adjust their glasses on the injection site. They apply SPF and rub it in. They fall asleep pressing their face into a pillow. Applying mechanical pressure to the area in the first few hours creates a real risk of toxin migration. Because the toxin isn't fully fixed yet, pressure can physically displace it toward adjacent muscles that were never meant to be treated. The most common result of migration: eyelid ptosis, a drooping upper eyelid, or facial asymmetry, or unintended weakening of a muscle that should remain active. Clinical guidance: keep the treated area free of pressure for at least 4 hours after the procedure. Sleep on your back for the first couple of nights. Exercise and heat. Intense physical exercise is contraindicated for the first 24 to 48 hours after botulinum toxin. And this restriction has a clear physiological basis. When you exercise intensely, two things happen: increased local blood flow and elevated body temperature. Both of these factors accelerate the toxin's metabolism, meaning it starts breaking down faster than it should. On top of that, increased circulation in the area can promote dispersion of the toxin beyond the intended target. The same logic applies to saunas, hot showers, intense sun exposure, and hot environments in general. Anything that raises local temperature and circulation can interfere with the toxin's binding process. Light movement, like a slow walk, generally fine. The concern is high-intensity cardio, heavy weight training, or anything that significantly elevates heart rate and body temperature. Alcohol, NSAIDs, and supplements. Alcohol should be avoided, and there are two reasons for that. First, alcohol is a vasodilator. It increases blood flow to the area and can worsen bruising and swelling, which tend to be more visible after injectable procedures. Second, alcohol has a mild anticoagulant effect, which can amplify any bruising already formed at the injection site. Ideally, avoid alcohol for 24 hours before and 24 to 48 hours after your treatment. The same applies to NSAIDs like ibuprofen and aspirin. They increase bruising risk. If you need a pain reliever, acetaminophen is a safer option. Certain supplements also warrant a pause in the pre- and post-treatment window. High-dose omega-3, vitamin E, ginkgo biloba, and garlic, all of which have relevant anticoagulant activity. What you can do. Now for the other side, because it's not all restrictions. You can apply light makeup after 4 to 6 hours, as long as you use a gentle touch and avoid rubbing over injection sites. You can cleanse your face gently with a mild cleanser and lukewarm, not hot water. Pat dry, don't rub. You can apply sunscreen with a careful light application, avoiding circular massage over treated areas. You should stay upright for at least 4 hours after your appointment. Don't lie down right away. You should stay well hydrated. The toxin itself isn't affected by hydration, but your skin's recovery and edema reduction both benefit. You should Follow any specific post-care instructions from your injector. Some protocols recommend gentle facial muscle contractions in the first few hours to assist controlled distribution. Always defer to the professional who treated you. Red flags. These signs warrant contacting your provider. Eyelid ptosis. A drooping upper lid appearing 48 to 72 hours after treatment. Progressive asymmetry between both sides of the face. Difficulty moving the forehead or brows in a way that feels very different from expected. A bruise that keeps expanding or becomes significantly swollen. Systemic symptoms. Difficulty swallowing, generalized muscle weakness, double vision. These are rare, but they exist. In the vast majority of cases, local complications are manageable and reversible. The key is communicating early with your provider when something doesn't feel right. To summarize what the science tells us, the first 48 hours after botulinum toxin represent the toxin's binding window at the snare complex. During this period, no mechanical pressure on the area, no intense exercise, no excessive heat, no alcohol, and avoid anticoagulants. What you can do: gentle skincare, hydration, careful sun protection, and staying upright for the first few hours. Every single restriction has a clinical mechanism behind it. Understanding that mechanism is what separates a good result from a compromised one. If you want a complete technical reference for post-procedure care across all major aesthetic treatments, not just Botox, I've put together an ebook specifically for that. The link is in the description below. Whether you're a practitioner or a patient who takes their treatment seriously, it's built for you. If this video gave you a clearer picture of why each restriction exists, hit like. It helps this channel reach more people who actually need this information. Drop a comment below. Have you made any of these mistakes after a Botox treatment? No judgment. Most people never get this explained to them properly. And if you want to go deeper on how botulinum toxin actually works, the cellular mechanism, what makes it last longer or wear off faster, the videos above are the perfect next step. See you in the next one.